Welcome to Virtual Reality Exposure Therapy Treatment for Post-Traumatic Stress Syndrome in Military Veterans. I am Joy Campbell and I'll be presenting tonight. PTSD, as it is commonly referred, is a psychological disorder that develops after a traumatic event involving death, injury, or threat to the welfare of an individual. Anyone can develop PTSD, but our military personnel are the group most commonly affected. The statistics shown on the slide is based upon the Department of Veterans Affairs research. Please note that there's a wide range of ages among our veterans now. Veterans from the Vietnam era are in their 60s, while the veterans from our current conflict are in their late 20s. The literature review conducted involved 4 randomized controlled studies. Each study compared VRET, the acronym for Virtual Reality Exposure Therapy, to another treatment to determine its effectiveness. The current standard of care for PTSD includes cognitive behavior therapy, CBT, medication management, as well as individual or group therapy, or a combination of these modalities. VRET utilizes a headset connected to a computer. The patient wears the headset, which can be programmed with realistic images from a combat zone. Sounds, smells, and images are controlled by the programmer, which allows for the intensity to be decreased or increased based on how the patient's tolerating. This allows the patient to develop the coping skills necessary to reduce the severity of his symptoms. Exposure and imagination also places the patient back in the event. However, it is done through verbalization, and it's up to the patient to visualize the scene in his mind. Because PTSD is similar to other social anxiety disorders, such as agoraphobia, which is the fear of public places, articles testing VRET's effectiveness in treating these disorders were also included. EIV is the acronym for Exposure in Vivo, and that's a treatment that involves the patient confronting the specific object, setting, or situation which triggers their symptoms. All the studies randomly assigned the subjects to various groups. 2 studies were conducted at treatment facilities, and 2 were conducted at universities. The sample sizes ranged from 10 to 97, and it was difficult to compare the studies as McClay, Gamito, and Meyerberger used number of sessions of exposure, while Anderson used minutes of exposure. Although each study had its own unique characteristics, all found that virtual reality exposure therapy can be effective treatment in decreasing the symptoms of PTSD and social anxiety disorder. So what does this mean for psychiatric nurse mental health practitioners? For me, it reinforces the concept that nursing interventions must be based on evidence-based practice. We have to be receptive to new treatments and stay on top of the research being done. VRET is very appealing to our younger generation of veterans, as it very much mimics the video games in which they so enjoy. Different generations will need different treatment modalities, and it is up to the nurse practitioner to determine which modality best fits her patient. Psychiatric nurse mental health practitioners do more than just prescribe pills. We are truly involved in the treatment of the patient. VRET can be a successful treatment in outpatient settings, which is the intervention I'm proposing. VRET being done in outpatient settings such as the VA hospitals, military treatment facilities, which is where our active duty servicemen and women receive treatment, and once they're deployed, they are considered veterans. Also, behavioral health clinics in the community would also be an excellent place to implement this intervention. Research demonstrates that VRET is an effective treatment for PTSD and associated social disorders. Thank you for your attention. I look forward to seeing your questions and comments. Have a very pleasant evening.